Alright, now let's talk about antacid. In the previous video, we've talked about proton pump inhibitor and we've talked about H2 blocker. So today we'll continue from antacid. Now, antacid, what they do is that from the name, they antagonize the acid. So they are majorly alkaline substances. So they just go there, they cause chemical neutralization of the acid. They don't act on any receptor, they just cause what? Chemical neutralization of the what? Of the acid. Now, there's a drawback to this. One thing about them is that they are fast acting. They cause that symptomatic relief. So if a patient is having that chest burn and the rest, those signs of peptic ulcer, if you give them antacid, it will cause quick symptomatic relief. Because what? Quick symptomatic relief. Okay, they are very, very fast acting. Very, because they don't need the receptor, they just go there, they neutralize the acid. Are you getting it now? So, but there's a drawback to this. The drawback is that when they neutralize the acid and the pH of the stomach gets above 4, when the pH of the stomach gets above 4, greater than 4, a rebound acidity will occur. That is the drawback of antacid. It will cause what? Rebound acidity. The body will carry out a reflex action in an attempt to increase the acid secretion. Okay, so that is the major drawback of antacid. Okay, so whenever they increase the pH more than 4, the body will undergo a reflex action in an attempt to what? Secrete more acid. That's why their action is always very, very fast and short. You will see that they will cause quick relief, but again, the pain will resurface again when the body reflex action has taken place. You get it now? So if you are asked, antacid are very, very fast in action, but their action is quickly terminated because of the rebound acidity. Okay, so the first antacid that was developed, the first one we were using was sodium bicarbonate. But for now, sodium bicarbonate is not popular again. We don't use it that much again. There are certain reasons why we don't use it again. Number one reason is because in heart failure patients, they can increase the sodium load. Okay, they can increase what? Sodium load in what? Chronic heart failure. Patients that are heart failure patients, they can increase the sodium load. You can see sodium here. So they can increase sodium load. Another thing again is that they can cause metabolic alkalosis. So they can enter into systemic circulation and cause what? Metabolic alkalosis. That is another reason why we don't use them again. And apart from that, if they react with the acid in the stomach, they can release CO2 gas. And you know CO2 gas will cause what? Belching. So the third reason why we don't use them again is because of what? They can cause what? Belching. So this is the third reason why we don't use sodium bicarbonate anymore like that. Okay, so sodium bicarbonate was the first antacid that was used, but for now it's not to use again. Reason because in heart failure patients, they increase sodium load, they can cross the they can be absorbed into systemic circulation and cause metabolic alkalosis, and they can cause belching when they release CO2. Now the next question you want to ask me is, which one are we now using? Which alkaline are we now using? Which antacid are we now using? Now the antacid that is now being used are the ones from magnesium and aluminium. Okay, the one from magnesium and aluminium. So we have magnesium hydroxide and we have aluminium hydroxide. So these are the ones that are being used nowadays: magnesium hydroxide and aluminium hydroxide. Now magnesium hydroxide is fast acting. But it can cause something like a diarrhea. So laxative, they act as laxative. Okay, they act as laxative. Then aluminum hydroxide is slower acting, but causes what? Constipation. Okay, slower acting but causes what? Constipation. So what we now do is that we combine both drug into one single drug that is called what? Magarate. So you can see magnesium, you can see aluminium, So it's a combination of both magnesium hydroxide and aluminum hydroxide. Are you getting it now? So when we combine this drug, these two antacid, we have certain benefit from it. Imagine this one now. This one is causing a diarrhea kind of symptom. This one is causing constipation kind of symptom. So if you combine both of them, their side effect will cancel out. Then again, another reason of combining them is that when you combine them, when they want to work, magadrate will release fresh aluminum hydroxide. Fresh aluminum hydroxide. This fresh aluminum hydroxide is more effective compared to when you give this aluminum hydroxide alone. Because when you give this aluminum hydroxide alone, it can undergo polymerization reaction during storage process. Okay, and from there it will become less effective. But when you give it in the form of magadrate, when you give that magadrate, it's going to release aluminum hydroxide, which will now have a better effect in alleviating that ulcer pain compared to when you give only aluminum hydroxide alone. You get it now? So that is another reason why we combine them. But the major reason again is that they cancel out their side effects, so they are very, very effective. Okay, so that is for that. So another antacid that can also be used is magnesium trisilicate. Magnesium trisilicate. Okay, magnesium trisilicate can also be used, but take note that magnesium sulfate is only used as a laxative. It's only used as a what? As a laxative, not as an antacid. Okay, so with this now we're done with antacid. I said antacid, what they do is that they cause chemical neutralization of the acid. They don't act on any receptor, they just neutralize the acid. Then I said they are quick in action, but their action is quickly terminated. You get, they are quick in action, but their action is quickly terminated because of rebound acidity. Then we mentioned about three main types. The first one was sodium bicarbonate. Here we said is no longer to use again. Reason because it can cause belching, it can increase sodium load in heart failure patients, and it can cause metabolic alkalosis. Okay. Then we said which one do we now use? We use magnesium. We use aluminum hydroxide. Okay. So magnesium hydroxide is fast acting, can act as a laxative. Aluminum hydroxide is slower acting, can cause constipation. So we combine both of them to have a better effect. Are you getting it now? So this is for antacid. Then also take note that magnesium trisilicate can also be used as an antacid, but magnesium sulfate is only used